Today we're going to explore a single leg dynamic alternate version of a hip 90-90 with internal rotation focus. Sit down on the ground, flex your knees and bring them so they're approximately shoulder width or wider apart. Drop one knee down as far as you can to the ground. You will likely feel the tightness deep in through that joint of the leg you're dropping, likely around the front or inner parts of the hip groin area. Then bring it back to the start position and repeat. The other leg does not need to stay still. In fact, slight rotation is important to allow for maximal rotation of the main leg into the position. There are multiple ways to perform this mobility exercise. You can focus unilaterally and perform 15 to 20 reps on each leg individually to work through the internal rotation quite strictly as shown. Another way to perform this is by utilizing a stretch and hold once you've reached the bottom position. By incorporating thoracolumbar rotation, you can further increase the capability of the hip to reach deeper internal rotation. You can also make this quite a dynamic mobility exercise by incorporating alternating hip internal rotation from side to side. This involves more control through the hips and encourages further compensatory patterns from the opposite hip. One important tip if you are starting to try this position for the first time is that the degree of how upright you're sitting will influence the difficulty in the movement. Sitting more upright increases the flexion occurring at the hip, which can be more difficult and sometimes uncomfortable for some, but sitting further back will alleviate this and reduce the hip flexion demand required. For some, it might be better to start in a more leant back position and slowly build up to a more upright position when rotation in a flex position begins to feel more comfortable. Remember, motion is lotion and practicing these movements will help reduce those hip pains and niggles.